Thank you for joining us for the 4th Annual Global Summit on Kidney Innovations, Global Kidney Patient Voice, the Key to Accelerating Innovation, a collaborative partnership between the American Association of Kidney Patients and the George Washington School of Medicine and Health Sciences. My name is Kevin Fowler, and I'm a former board member for the American Association of Kidney Patients, and I continue to serve as a AAKP Ambassador for the state of Missouri. I'm also someone living with kidney disease, having received the preemptive kidney transplant in 2004. And based upon my experience of living with the consequences of polycystic kidney disease and facing the reality of kidney failure, my goal was to avoid dialysis by receiving a preemptive transplant. And my hope for all individuals suffering from kidney disease and facing kidney transplant is for them never need to go on dialysis and to receive a preemptive transplant, so that a preemptive transplant becomes more the norm rather than the exception as it is right now. And as a fellow patient advocate, or as a fellow patient, I have a deep passion for patient advocacy and patient engagement in the production and device lifecycle of novel treatments that answer the need and preferences of patients and their families. And those that are going through the journey of kidney disease firsthand, who really know what it's all about. This passion has led me into a career spanning over 30 years in both commercial and research and development roles for commercial enterprises. In addition to my role with the AAKP, I'm also the patient editor for the Clinical Journal of the American Society of Nephrology, CJSN. I'm also on the board of directors for the Kidney Health Initiative, which is a public-private partnership between the American Society of Nephrology and the US FDA. KHI has a mission to catalyze innovation and development of safe and effective patient-centered therapies for people living with kidney diseases. And for today's session on Global Kidney Patient Voice, the key to accelerating innovation, industry efforts across the globe advancing kidney patient care, I had the pleasure of conducting a series of interviews with national and global companies in the kidney space that are leading the effort to disrupt the status quo by making an investment in new treatments to address the many unmet needs of people living with kidney diseases, while also working tirelessly to integrate the patients and their unique insights along the way. In full disclosure, based upon my professional background working with life science companies, I have consulted for some of the organizations that I have interviewed. I enjoyed speaking with all these industry representatives across the globe and ask you to join me in watching excerpts of these interviews. Full interviews will be available post-Global Summit on demand on AAKP's social media platforms and YouTube channel. Thank you, and I hope you're just as inspired listening to these discussions as I was conducting them.
The patients are always at the center of everything we do. No matter what our role is in CSL Vifor, we try to keep the needs and the preferences of the patients up front. In fact, those two components are the main fuels of what we are trying to accomplish here within our firm. And it's an imperative to have needs and preferences of patients up front so that we can customize our research, our development, our clinical trials, and our real-world evidence trials to meet those needs and preferences, to devise solutions that address those patient concerns. So if we can continue to keep the patient need and preferences as our North Star, we believe that we'll meet what they need, what they desire, and what they require each and every time. So I think the key sentence that you spoke within that question is patients leading the discussion. That's extremely important. Nobody can emphasize that enough, including myself. The patients are and will continue to be the best advocates, not only for themselves, but for all other kidney disease patients or patients who suffer from a comorbid condition related to kidney disease. It's really beneficial for firms like ours to partner with AAKP because they magnify the voice of the patient and help us hone in and laser focus on exactly what the patient concerns are. We want patients to continue to be proactive in raising concerns to their healthcare providers, to our patient advocacy groups, and if possible, directly towards biopharmaceutical companies like ours. But it's also our responsibility to bring patients into the decision-making process. So as long as patients continue to advocate, we need to take that advocacy and incorporate it into our decision-making and go one step further and incorporate their presence into our decision-making. So every discussion that we have in our company starts and ends with the patient, their concerns, their unmet needs, and what we can do to fulfill those needs. CSL Vifor, which some of you may know of previously as Vifor Pharma, aspires to continue to be a global leader in iron deficiency and nephrology and rare diseases. And our commitment is to launch a set of new therapies that meet the needs of kidney disease patients where they are right now. We focus on kidney disease, pre-dialysis, and in dialysis itself. Ultimately, we want to help patients. We want to serve them as best as we can so that they can live as healthy a life as they can as they endure kidney disease.
I'd like to thank again the vast number of industry partners that took the time to sit down and have a discussion with me. Through AAKP Global, launched in 2019, AAKP is engaged globally because we are committed to educating patients, leaders, and companies across the globe on the importance of kidney disease prevention, new innovations in treatment, and the opportunity to save more lives. We believe that united patient voice can drive innovation and the policy decisions that determine timely regulation and payment for new and safe treatments. Globally, AAKP is working with patients, medical professionals, researchers, and medical industry allies, such as those you just heard from, to cultivate a united consortium led by patients. AAKP believes that this global consortium can advance innovation and change kidney care in countries where health systems or infrastructures do not support patient-consumer choice or access to care treatments. Again, thank you to each of our industry partners for sharing with us the innovations their companies are working on or has available to improve kidney care from prevention and diagnosis to transplantation or access to care treatments.